Welcome back to another episode of Minty Fresh Takes. I'm your host, Xander Huff, with Dr. Jordan Harper. In our first episode, we introduced to you Enamel and explored how oral care can be more than just a routine. It's about wellness and sustainability. Today, we're taking it further and diving into how a healthy mouth can enhance your natural beauty. In this episode, we will talk about how oral wellness directly impacts your appearance. From understanding the science behind a radiant smile to tips on achieving one, we've got a lot to cover. Let's explore how oral health isn't just about function, it's also about looking and feeling your best. Dr. Jordan Harper.
Thank you, Xander. Glad to be back.
Of course.
Had a lot of fun last time.
Absolutely.
So a lot of people have no clue what goes into making a podcast, but it's actually quite fun. So
yeah, that's right.
Home, so.
That's right. And listen, it seems like we've got great reviews. A lot of people are saying a lot of great things about it. So
absolutely.
We're excited to get into episode 2 today for you guys. So to start, can you give us a recap of what we talked about in episode 1?
Yeah, absolutely. So introduction to the brand Enamel, what it is, how microhydroxyapatite is so much better and different than fluoride, as well as how much better a toothpaste tablet is over regular paste from both a sustainability standpoint and just an overall use standpoint, and how user-friendly it is. And how with Enamel, we really identified a niche in the market where everyone has this wellness, and that seems to apply to your skin on your face and your hair, but in your eyebrows and your eyelids, and eyelashes even, right? But like, no one talks about teeth. Why is oral wellness not in self-care and self-wellness, right? And so with Enamel, that's what we're trying to do, is trying to find that. We found a gap in the market where arguably the number one thing that is the most important about a physical appearance is your teeth, because that's the first thing people notice. And so with Enamel, we kind of identified that gap, and we're trying to allow oral wellness to become part of your self-wellness routine.
How does a healthy mouth contribute to overall beauty and wellness?
There's a really famous picture that gets used probably in every dental school in the country, and I don't know if you've seen it, but it's a really clever picture where it's like this family and the dad's smiling, and so he's smiling with his kids or his wife or something like that, and he's missing one of his front teeth, missing a central incisor, and the caption goes something along the lines of yes, he's missing a front tooth, but did you also notice he's missing an eyebrow? And then when you go back and look at the picture, you totally miss, oh my God, he was missing an eyebrow. And the emphasis of that image is the importance of teeth, right? It genuinely is what, when you smile, that's the first thing people notice, right? People look at your teeth. Yeah, they maybe look at your eyes, your ears, your hair, your eyebrows, your eyelashes, all those things, but the first thing people are going to notice is your teeth. Yeah. And that's where it all starts, and that's why it's a super important aspect of your overall beauty.
What are some specific ways a radiant smile and a healthy mouth can make someone more visually appealing?
Being that most people notice teeth first, right? The way smiles make people more visually appealing is believe it or not, they've done studies where what does an attractive person look like based on their smile, right? And the attractiveness rating goes up as the smile gets better. Well, what makes a better smile, right? And as dentists, we look at a variety of things between, not just, everyone's worried about the color of the teeth, right? You can have an ugly smile with bright white teeth, right? If all the teeth are the same shape, or all the teeth are the same size, or all the teeth are, level on the incisal edge plane, So a truly attractive smile is multifactorial, right? You've got a variety of aspects. Yeah, shade's one of the things in the quiver, but the other things are things like proper shapes of the teeth as it relates to, is the patient male, is the patient female, is the patient older, is the patient younger? All these things have to be taken into consideration, as well as the facial profile of the individual. That also influences the shape of the teeth that we make. The other thing that is super important, in addition to shape, is also size. And you don't want to give people Bucky Beaver teeth. You've got to have something that just fits their facial profile properly. And so all these things are things that we're considering when we talk about a healthy smile. And what's interesting is when we go to some of these cosmetic lectures for CE, you're getting all sorts of different inputs on, well, if a midline is shifted, like say Tom Cruise, right? Very well known midline shift, right? If a midline is shifted half a millimeter, does someone notice? And the answer is no. If it's a millimeter, no. you got to get to over a millimeter before someone really starts actually noticing that the teeth aren't positioned properly. And so it's just really fascinating to like dive into all these little nitty-gritty details about what makes a perfect smile, because all those little small details add up to making that perfect smile, which ultimately makes that person more attractive.
You often say that oral care is self-care. Explain how that concept ties into like looking and feeling beautiful.
Absolutely. So everyone to a certain degree has some sort of self-care routine, right? For a lot of people that looks like, brushing their teeth, taking a shower, washing their hair, those types of things, keeping their nails clipped, all that type of stuff, right? What's interesting, I think, is you've got this self-care routine and a lot of people, a lot of the ladies will be focusing on, their eyebrows and eyelashes and skincare, and they're doing all this skin product for their face to keep their face looking beautiful and acne-free and all this stuff, right? And it's almost like oral care gets lumped into this like crummy obligation. I've got to do it. I don't want to do it. I struggle with my 3-year-old, right, to get her to brush her teeth, right? And it's one of those things where I think there's maybe a stigma that's developed where it's like we as dentists, it's like, we're it's too authoritarian. It's like brush your teeth twice a day because we tell you to, right? It's like, whoa, time out, right? You should be brushing your teeth twice a day to maintain your physical appearance, to maintain your teeth, to keep yourself healthy, because your mouth is the beginning of the whole healthy routine inside your body, right? And so if you don't have good teeth, you're not going to be healthy, and we'll touch on that later, I'm sure. But to me, I really thought it was important that we come at brushing our teeth and taking care of our teeth from a wellness standpoint, because I don't want it to be, I got to brush my teeth because my dentist told me to. I want it to be, I got to brush my teeth because I want to stay attractive, I want to stay healthy, I want to stay fit. That's where it all starts, right? And so that's where a lot of our push is we're trying to get people to understand. It's like, look, okay, yeah, you're taking care of the bags on your eyes, and you're taking care of your skin wrinkles, and you're taking care of your acne. What about your teeth, right? And everyone feels like this awful obligation to brush their teeth, when really it should be like, hey, this is the best thing I do of my day, because this is literally what contributes probably the most to my overall health for my life. And so anyways, it's just conveying that to people and educating them on that. But color's the first thing, because I think people associate stains with decay and rotting and all that type of stuff as it associates with teeth. So I would say color's number one. Number two would be some people when they smile, you can see their gum tissue, right? Gums are naturally supposed to be pink. If it's on a I think if you see a lot of red and bleedy and that type of thing, gums, that can also be kind of a turn off. And then lastly, I think it's probably alignment. Teeth being in the appropriate position in the face. That would be the other way.
How does oral health affect facial aesthetics? So your oral health, and I'm gonna bring an example that most people haven't probably thought about, but if you go, let's say you go to assisted living facility, right? And you've got a lot of people that are in their 80s, 90s, right? Their poor teeth, are on their last leg if they have any left, right? If you start looking at the facial symmetry of those patients, what you're going to notice is what I call a sunken in appearance, right? So they've got the pursed lips, their facial structure is collapsed, right? And the reason that happens, and then obviously that exacerbates wrinkles and everything else, but the reason that actually happens is they've lost what's called vertical dimension of occlusion. So basically the vertical aspect of their jaw that's held up by their teeth, they've lost it, right? And lots of them don't wear dentures because the dentures are terrible fitting, right? But it's a great visual to help kind of explain to people is like, when you get that sunken in appearance, that's what it's from, is losing and missing teeth, right? Well, if you maintain your teeth and keep everything happy and healthy, you maintain that vertical, right? And that again, all plays down to your facial symmetry and your jawline. Gum color, teeth alignment, even breath freshness. Why is this so important in making someone appear attractive?
A lot of different things. I think, I'll touch on the breath part first. Like, as far as breath freshness goes, there's aspects in dentistry. Everyone heard sort of gingivitis, right? I feel like that's like the number one thrown around term on every toothpaste advertisement, right? Gingivitis, you break the word down, it's simply inflammation of the gum tissue, right? But what a lot of people don't know about is periodontal disease, right? And so that's a disease of the periodontium. So that's actually the bone that holds the tooth in place, the socket, if you will, And so the breath freshness part, a lot of that stems from Patients that can have severe cases of gingivitis and or periodontal disease, you'll get a lot of that from there. But also too is the back of the tongue. Lots of people don't realize that they actually need to be brushing their tongue. Everyone gets talked about their teeth. They have no clue about the tongue. And guess what? All those bacteria that make all those wretched smells, right? A lot of them live on the tongue. And that's why things like tongue scraping and that type of thing are important. If you look at a lot of the little single-use, or not single-use, but the little, toothbrushes are designed to last a month, right? Most people don't realize if you flip that toothbrush on the back, that's a tongue scraper. And most people have no idea why the back of that has a little ribbed nylon on it. And it's because it's a built-in tongue scraper. And that's, again, it's another thing where we're trying to help educate the general public on ways to help take care of themselves to maintain their appearance.
As a dentist, how often when people come into the clinic do you see them actually scrubbing their tongue?
Are you asking how many patients actually do it?
Yeah.
I would say probably less than 1%.
Wow.
You'll definitely see call it like, this might gross out some viewers, but we definitely see like what we call the furry tongue, where it's like you've got some growth on your tongue, It's like, we might want to brush that, But again, it's just one of those things that unfortunately the general public hasn't necessarily been educated on the best ways to do it, and hence this podcast, right? Hence us trying to get word out there on, hey, look, there is a better way to help, keep everything fresh and clean, because that's going to help contribute to the overall oral health. So as far as the gum color goes, we touched on it a little bit earlier. The gums are supposed to be nice, pink, and healthy, right? And when you have, any type of either, whether it's gingivitis, periodontal disease, and the gum tissues all red and bleedy and puffy, right? That creates lots of inflammation. And so the body's sending all these cells to get those plaque biofilms, people call it tartar, calculus, whatever you want to call it, right? Off the teeth, right? Well, the problem is the teeth are actually outside the body. But people don't realize that, right? Is the coronal structure of the tooth is actually on the outside of the body. So the body's sending all these cells to get all that junk off the teeth, and it can't. So it kind of acts like a splinter, right? So you end up getting this inflammation of the gum tissue, the gums bleed, right? And so the thing that I want to emphasize, and I have to emphasize to patients a lot, is a lot of patients will tell me like, oh, well, my gums are bleeding, so I quit brushing. Oh, no. Reverse that. Your gums are bleeding because we're not brushing good enough. I need you to brush that area more, right? Because I need you to get that stuff off so they don't bleed, right? Bleeding is a sign we got a problem. So you need to go after it. You need to get in there with that floss. You need to get that stuff cleaned out. And so it's just super important. That's why you come to the dentist every 6 months. Some people have to come every 3 months, right? Because there's 15% of the patient population is periodontal patients, right? So they have to come every 3 months because they have to get all that stuff off because they build it so rapidly, and all that contributes to, healthy gums.
Is there research that shows a direct link between good oral health and the perceptions of attractiveness?
Absolutely. I mean, we touched on a little bit earlier. There's studies that, they would take a lineup, and a lot of these were based on actually like psychological type studies, right? Psychologists were doing the studies. And so there's studies where they would line up people and they would rank them on attractiveness, right? And more often than not, the people that got ranked to be more and more attractive had perfect teeth, right? Perfect alignment of teeth, proper facial proportions, proper color, all these types of things. And so 100% there is a link to, having the teeth play into your overall oral beauty.
Dr. Harper, walk me through the actual science of oral health and keeping the tooth healthy.
There's reasons that it's important to brush twice a day, or more, right? There's reasons that it's important to come to the dentist regularly. And all of it has to do with keeping plaque biofilms off the teeth.
Okay.
So what happens is when we eat food, stuff gets caught. It develops a plaque biofilm. That mixes with some of the components in your saliva. It can eventually generate tartar. Think of it as like barnacles on a dock post. That's a great analogy, right? Is after 90 days, these solidified plaque biofilms build up, right? And then the calcium in the saliva can start being deposited, and you end up with this tartar buildup. And again, barnacles, right? Well, we've got to get all that stuff scraped off, right? Well, the importance of the it's a team approach, right? The patient has to do the at-home care part, right? And that's removing all of the bacteria that's in soft plaque and food the bacteria love to eat on, right? But the other important thing is coming to the dentist to get that stuff scraped off with instruments, because once it solidifies like a barnacle, your toothbrush isn't getting that off, right? Now we have to go in with our instruments and clean all that stuff off, right? And so the really important thing is when these plaque biofilms develop on the teeth, the reason things like periodontal disease occur is all this inflammation happens because the body sends these cells to fight that plaque biofilm. Well, the problem is the cells can't get outside, okay? So the cells are inside the gum tissue. The gum tissue gets all puffy and inflamed. That inflammation generates bone loss. Well, as you generate bone loss around a tooth, what starts happening to the tooth? It's more mobile, right? It's not staying in the socket solid, right? So now you're more susceptible to tooth loss. Plus, you've exposed the root surface of the tooth, which doesn't have enamel on it. It's got something called cementum, okay? And that is more likely to get a cavity on it because the root surface is not as dense as enamel, okay? So you can see this trickle-down effect, right? Where it's like, oh, I didn't go to the dentist for 5 years. Oh, I didn't go to the dentist for 10 years, right? It's so important to maintain this stuff because it's all maintenance, right? You start slacking on the maintenance, those barnacles on those dock posts are going to be hanging out 10 feet wide, right? And then you're going to see huge repercussions of that. A lot of times they're irreversible because once the bone loss happens, guess what? I can't put it back. I can't put it back. Bone grafting does not put it back, right? And that's a common misconception. Bone grafting, like when we're getting teed up for implants, is helpful, right? It gets bone to a degree, but that verticality of bone grafting just doesn't work, right? It doesn't last.
So we were talking a little bit off camera about the oral cavity.
Yep.
Could you kind of walk me through a little bit in depth of what you were referencing to there?
So yeah, so what you and I were talking about was basically that the mouth is the jumping off point of health for your entire body. And most people don't realize that the mouth's actually outside the body, right? So think of it, the alimentary canal is literally actually outside the body, even though everyone thinks of it as inside, right? But it's the start of the journey, right? So let's say we haven't been taking good care of our teeth, right? We haven't been brushing with enamel, and things start to fall apart, right? As teeth fall apart, and as you lose some of that ability to chew up that food properly with missing teeth, the bolus, we call it, of food is not small enough. So what does that do? Well, now, as you swallow and it goes into your stomach needs that food a certain size for the acid to break it down and absorb the nutrients. If the bolus is too big, are you absorbing those nutrients properly? No. Right? So again, it starts this cascade effect. So now the bolus of food's too big. You're not absorbing the nutrients you need. So now your overall health starts to deteriorate, right? Maybe you're more at risk for diabetes, whatever it is, right? And so it's super, super important to maintain the proper number of teeth because that's what allows you to chew the food small enough, to then get and stay healthy. And if you don't, then you're going to see consequences of that.
So I've read a little bit in the news about how there could be a potential link between oral health and heart disease. Can you kind of walk me through that?
Absolutely. So it's not could be, they've actually proven it. So there is a direct link between overall good oral health and bad oral health and how that affects heart disease. And so basically the bacteria that naturally reside in your mouth, right? If the populations get too overblown, too big, you end up having lots of inflammation and ways for these bacteria to get inside the bloodstream and inside the body. That can actually negatively affect the heart tissue, right? Because bacteria can settle on heart tissue, and they've done lots of studies proving that. The other big thing that's actually really exciting right now is they're actually also trying to tie this into Alzheimer's. So they're doing Alzheimer's research showing how, wait a minute, some of this bacteria that's in the oral cavity could begin to affect the brain. And again, it's just one of those amazing things where it's like the body's all tied together, the mouth's where it all starts, right? So you've got to maintain good oral health. You have to. It's just, if you want to maintain good self-care, good wellness for yourself, you've got to maintain your mouth. And another aspect of the science I'd love to comment on is the genetic component, right? I hear all the time, oh, I have bad teeth because of bad genetics. I have bad teeth because my parents had bad teeth. They were wearing a denture at 30. I'm going to have a denture at 30. That's not true, right? Yeah, are there genetic diseases or disorders that can affect the teeth? 100%, right? Is that what most people have? No. I mean, we're talking like 0.01%, right? I mean, it's like a teeny tiny amount of people actually have genetic disorders that actually affect the teeth, right? 99.9% of people can maintain their teeth, keep all their teeth, but they have to follow some simple instructions, right? Take care of your teeth at home with your self-care routine and go see the dentist, and it's just super important to maintain for that overall bodily health.
Important daily habits. Talk to me about kind of what we can be doing to maintain the oral health.
Absolutely, yeah. So the big thing day in, day out that you can do is, brushing your teeth in morning and night. Just incorporating that into part of your get up routine and your bedtime routine, right? When you're doing your other self-care stuff, whether it's showering, whatever, that's the easiest way. Flossing's a big one. Flossing of some kind, there's no substitute for string floss. It's the best. A lot of people use water flossers, but string floss is still the best. And then, like we talked about a little bit earlier in the episode, scraping your tongue, which I would bet 98% of people don't do.
Are there specific ingredients or products, just like what Enamel offers, that can really enhance the oral health in your appearance?
Yeah, absolutely. So the microhydroxyapatite that's inside Enamel, it can do a multitude of things, but the most important thing we're seeing is the remineralization effect of the tooth, and how it allows, the tooth to have this microhydroxyapatite reuptaken into it, to decrease the risk of getting those cavities and stuff like that. And then secondarily to that, you're also decreasing the sensitivity when you're doing that too.
How does Enamel's focus on natural ingredients play into both health and beauty?
So obviously, the last 20 years has been pretty eye-opening. We've gone through this organic phase of things, non-GMO, all these things, right, where we're trying to get more back on track to the way we used to be 1,000 years ago, right, where there was no artificial stuff. And just, what we're finding is a lot of this artificial stuff is shockingly, wow, shocker, it's bad for you, right? So it's like, just getting back to the basics, right, of getting something that's all natural, all organic, that will still be effective in doing what it needs to do. And that's the beauty of it.
Okay. Oral care mistakes. What are some people doing that they might not know about that's actually hurting their appearance?
One of the most interesting things, outside of not, we've already talked about not brushing your teeth and all that stuff, and not going to the dentist. Like, those are big mistakes, right? Here's one of the most interesting things that we're starting to learn, and the research isn't fully complete yet, so I don't want to say, oh, this is it, but this is what people are talking about is alcohol, liquid-based mouthwashes, and how it's destroying the oral microbiome, right? So what they're finding is it's killing everything. You need some good bacteria, because that's what's feeding your gut to help digest the food, but it's killing and nuking everything. And so that's why we're coming out with an Enamel mouthwash tablet, right? It's also microhydroxyapatite based. Doesn't have obviously the alcohol in it. Has very similar ingredients to our toothpaste tablet. It just foams a little more, right? So that you don't need the water, right? You can literally pop it in, swish, 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 and then just spit, right? And it would be a great little additive you can have when maybe you're off at school or off at lunch, off at work, whatever, and you don't have access to a toothbrush. It's another way, again, you can just help maintain that oral health.
One thing I notice when I use any mouthwash type is after I've got sensitive teeth, after I use it, it makes my teeth feel even more sensitive after about a week of using it.
Yeah, that's because it's so caustic. It's super strong, right? And the pH balance is off. And it's literally it's doing what it's supposed to do, which is put out everything like it's a wildfire. But at the end of the day, you don't want that. There's certain bacteria that are good bacteria. You want to keep those, right? And so it's a really interesting study that's that I'm tracking. It's gonna be really cool what they find out.
Okay. As a dentist, what are you looking for to assess if somebody has good oral health?
So to me, the very first indicator, if I see a new patient, they sit down in the chair, right, and I'm meeting for the first time, is how much stuff is on the teeth. That's number one, because that's where it all starts, right, is if there's lots of stuff caked up, gunked on the teeth, I'm going, oh boy, we're going to be really looking at these x-rays when I take them in a second, because there's probably going to be cavities, right? There's probably going to be other problems. There's probably going to be bone loss, right? So to me, that's the number one indicator. And I'm not saying, look, everybody gets cavities. I've gotten a cavity, right? It's unfortunately the nature of bacteria and the byproducts they secrete. They create holes in the teeth. It's almost unavoidable in someone's lifetime to not get a cavity. But definitely one of the key indicators is how much stuff's built up on the teeth.
What's a common myth about the oral health industry right now that you would need to debunk?
So I think the most common one I see is genetics cause my teeth to be bad, and that I get that a lot. There are genetic disorders that cause the teeth to be bad, but it's like 0.01%. I mean, it's teeny tiny. Most people have complete control over their oral wellness if they take care of it, right? It just involves brushing with a high quality toothpaste and going to see the dentist.
For anybody listening right now, give us at least one thing to do right now today that would improve our oral health.
I like to tell people, especially the people that maybe have been slacking.
Yeah.
Right? Everyone gets a slump in life and they maybe start slacking. I would say the biggest thing you do is draw a line in the sand and just start today.
Yeah.
Like start today going, when I get out of that shower or whatever it is you're doing when you start your self-care routine, take care of your teeth, take care of your teeth, take care of your teeth, right? Because remember that the teeth is the start of everything. I mean, that's the whole thing we've been talking about this whole podcast is the teeth start it all. So you got to start taking care of them. Don't tell yourself, oh, I haven't been taking care of them for 5 months. Why am I going to start now, right? Don't do that. Just start today. Like start a new aspect of your ritual.
Yeah, that's right. Okay, so we've got the Enamel products right here in the to-go baggies. They look great.
Yep.
Little sample pouches for now.
Yep.
Kind of give us an update if you want to hold this right here.
Yeah.
Give us an update of kind of where Enamel is right now as a company, what you guys are looking at.
Yeah, for sure. So we're gonna do a little bit of a soft launch, kind of a teaser launch.
Okay.
We've had tons of patients and people reaching out wanting the tablets, right? And so what we've decided to do is just give people these kind of little resealable little teaser pouches. We only have a limited number of them, but just so people can get their hands on it and start trying it. Okay. We're still about 6 weeks out, probably from the full-blown launch with our formalized glass jars. But we had some extra tablets, and we just thought it'd be a good thing to get people to start talking about it.
Absolutely. Okay, one last question for you.
Shoot.
Not on the script. Talk to us about the cup. What we got on it?
So this is my mentor, Dr. Thomas Dork. So he is just amazing prosthodontist. He was one of my professors at dental school. And when I bought this practice, he gifted me with some mugs. And so it says, what time did the man go to the dentist? Well, of course, the natural answer is 2:30. Say 2:30 fast and you'll get it.
Oh my gosh. Well, that's going to wrap up everything about this episode today, episode 2 for Minty Fresh Takes. If you want to learn more about how to enhance your health, about your beauty, your oral care, be sure to follow us on Instagram at Minty Fresh Takes and at ENML Toothpaste Tablets. If you enjoyed this episode, please don't forget to subscribe on YouTube. Leave a review, share it with someone who might benefit from these tips. We'll see you next time. Thank you.